this is the Regional Center. How can I help you?
Hi, this is Kathy Hernandez, and I wanted to know if I could speak to my caseworker, Adele.
Sure, Kathy. Hold on a moment, and I'll get her for you. Hello, this is Adele.
Hi, Adele. This is Kathy Hernandez.
Well, hi, Kathy. How you doing?
Okay.
Hey, what can I do for you?
Well, I was watching something on TV the other night, and they were talking about breast cancer.
Oh, And?
Well, it kind of made me nervous, and I wanted to come in and talk about some things, maybe some private things.
Well, it sounds like you have some questions about your medical rights and maybe some of the things you need to be doing. Let me look here. Do you have some time, say 3 o'clock today?
Mm-hmm.
Okay. Well, then I'll see you at 3.
That would be great. I'll see you at 3.
Okay. Bye-bye.
Bye.
Hi.
Hi, my name is Kathy Hernandez, and I'm here to see my caseworker, Adele.
Adele Emery?
Mm-hmm.
Okay, just a moment. I'll page her for you.
Okay.
Adele Emery, please come to reception. Adele? She'll be with you in just a moment.
Okay, thank you.
Okay.
Hi, Kathy.
Hi, Adele.
It's good to see you.
Good to see you, too.
Want to come back to my office?
Sure.
So you saw something on TV that made you nervous.
Yes.
What was it that you saw?
There was a new show about women and breast cancer.
And why'd that make you nervous?
Well, I've never been tested by a doctor, and I wanted to know if I should be.
Well, why don't we come in my office and talk about it?
Okay.
You sit here. Well, Kathy, I can understand your concern. Breast cancer is a serious subject, and once you get to be a certain age, you're at risk for it. Doctors can test for it, though, and if it's found in time, it's usually treatable. What's also important is that when you go to the doctor, he can teach you to do a breast exam, and you can check yourself each month.
I'm almost 40. Should I get an exam?
Well, you are reaching the age where you should have a mammogram. That's the name of the test they do for breast cancer.
So, should I make an appointment with my doctor?
Well, you can. Do you like the doctor you have now?
I guess.
Does he listen to you well?
Yes.
Can you ask him questions and tell him how you're feeling?
I think so. I usually don't ask too many questions.
It's important for you to have a doctor you're comfortable with. If not, you and I can start together to look for a doctor that might better suit your needs.
So I should go to a different doctor if I want to?
Right. It may take some time to find one, though. All those questions I asked you about your doctor, those are very important. As an independent adult, it is important that you feel empowered when you go to your doctor. You live on your own, right?
Yes.
Do you have any help?
Yes, I have an independent living service worker who comes every day to help me with the little things.
So when you go to the doctor, you give them your Medi-Cal card, right?
Yes, I do.
Then it may take some time to find you a different doctor. If you need any help finding a new doctor, I'm a good place to start. You can ask your caseworker, or you can always call the health department, and they can recommend a doctor that will accept Medi-Cal.
So would you recommend that I go to a different doctor?
Well, that's a decision that you have to make. Part of being a grown-up is making adult decisions. Knowing if your doctor is treating you right is a very grown-up decision that only you can make. Kathy, can you tell me the name of your doctor?
Sure, I go to Dr. Williams.
Good, Kathy. It's important that you can remember the name of your doctor in case you ever have an emergency.
How do I know if my doctor's any good?
Well, it's important to have a doctor that listens to you. It's also important to have a doctor that's gentle with you and is willing to listen to your feelings. These same things apply to your dentist, too. Your dentist should be gentle and willing to listen to your needs. Just remember, you never have to keep a bad doctor or dentist that you don't like. It's your right to have a doctor that you believe treats you well.
I know that I had a problem a few months ago when I lost my medical card and I needed to go to the doctor. What should I have done about that?
Well, first of all, I should have a copy of your Medi-Cal card here. If I don't have a copy, you should bring in your Medi-Cal card and I can make a photocopy. If you lose your card, we can use the copy until you get a new one. Also, if you lose your card, call me and let me know. Your caseworker should be able to help you get a new card.
I think I'll make an appointment with my doctor for that breast exam.
Good. I'm glad to hear that you're taking responsibility for your own health care. Have you ever been to see a gynecologist?
Yes, I have.
That's very important, Kathy. Since you're over 20, you should be seeing a gynecologist every year. Finding a gynecologist that you like and feel comfortable around can be difficult. Do you have a male or a female gynecologist?
A female.
Knowing if you want to go to a male or female doctor is usually the first step in finding a gynecologist you like. You know, you could ask your friends who their doctor is. They may be able to help you find a good doctor that you like.
Well, now I know how to change doctors if I want to.
And you're going to make that appointment for your breast exam?
Yes, I will.
Well, Kathy, I'm so glad you came by to see me. Anytime you have a question about your health or your doctor or any of those kinds of things, please feel free to call me or come by and see me. And you know what? If I don't know the answer to those questions, I'll find somebody who does.
Okay, Dale. Thank you so much. Bye-bye.
See you, Kathy. Bye-bye.